I guess my wife was the first person to realize something was wrong during the pregnancy.
You know, we were in the hospital with him from day one.
At 10 months of age, he was only 8 pounds, and we couldn't get in enough nourishment with the alternatives that were available.
It's not something that anyone asked for.
I thought that when I got her home, everything would be hard because I didn't have somebody standing over me, directing me how to do it. I was on my own.
Obviously, it's a little fearful to do something that you've never done before at first.
You'll find that you will go through a period where you're scared, where you have questions, but you'll also find that the process is not as bad as you think.
An infant, or a young child, depends on their parents for just about everything. Food, clothing, shelter, just to name a few. All of these are necessary for the child to develop and grow into a healthy adult. You've learned that your child needs the assistance of a feeding device. This tube will ensure that he or she receives a proper amount of nutrients. This is essential for your child to grow, heal, and feel better. We understand that this is hard for you, as a parent and as a family. It involves learning new skills and a new way to feed your child. While there are many different conditions that children are born with or develop which interfere with their ability to eat or drink, families often have a common initial reaction.
It's a scary process, and it's scary because it's your child, and most children that require this surgery to be done, these are children who were either premature or had some issues that the parents didn't expect, meaning they were born this way, and this was just a whole road that the parents had to take and didn't expect to.
I held out for almost 2 years before I'd let the procedure be done. And a lot of it was fear. I wasn't sure what to expect, and no one had really convinced me that it was going to make a change for her.
Taking care of a child with a gastrostomy tube is something you can do. You will be helping your child to thrive and to grow. This video has been produced especially for you, to help you know what to expect and how to take care of your child's gastrostomy. Now, let's get started by reviewing the gastrostomy procedure.
A gastrostomy is the creation of a small incision in the skin and the stomach wall. A feeding tube, or catheter, is then placed in the opening, which will enable you to give your child nourishment directly into their stomach.
We wanted to know all the other options that were available. We didn't want to do the surgery, we were scared.
You can do it. That's definitely, you can do it. It's not something that anyone asked for, but I think once you're put in a situation, you're given some strength, and you sometimes you have to call on it from day to day, hour to hour, but it comes, and you can just keep moving on. And once your child is progressing to a point, you don't want to go back, so you keep pressing on.
A trip to the hospital for surgery can be frightening for anyone. If possible, visit the hospital before your child's operation to become familiar with parking, where the elevators are, and to find out what you might need to bring. We also recommend that you bring one of your child's favorite dolls or toys so they have something familiar to comfort them when they wake up after their operation.
The day of the surgery, the worst part is waiting for them to come, because you just keep thinking about what's going to happen.
On the day of surgery, needless to say, my husband and I were very scared. I mean, we paced the floors, we waited, you go through all the emotions. You're crying one minute and you're kind of happy about, okay, well, this has given him a chance to live, and it's given him a chance to get the nourishment that he needs. So you go through a lot of those different fears.
Your pediatric surgeon will probably choose one of these 3 catheters: the Pezar catheter, the Malacot catheter, or a skin-level device. If your child receives the Pezar or Malacot catheters, they will soon be replaced with the skin-level device. This will occur at the time of your surgical follow-up visit, which is usually 3 weeks after the initial surgery.
You know, we were in the hospital with them from day one, and watching the nurses and asking questions and letting them, you know, they're, not only will the nurses and the staff at UNC, you know, do the job, but they'll also teach you how to do that. And that's their goal, is to teach you to be self-sufficient.
There were pamphlets that were given out. There were hands-on teaching. Lynn would do teaching, and she'd have me to do a return demonstration to make sure that I knew and I was comfortable with what I was doing. And I mean, and they'll tell you at the hospital, it'll take a little while for you to get used to, but once you're comfortable leaving the hospital with those steps, once you get home and you do it for a couple of weeks, you know, you get pretty comfortable and say, hey, I can do this.
The day after your child's surgery, you will need to start cleaning the gastrostomy site. There will be a small amount of redness surrounding the tube, and it will be tender. The site may also drain a small amount of yellowish fluid. This fluid will dry and form a crust around the site. This area must be kept clean and dry to prevent infection and to promote healing. It is also important that you keep tension off of the site and tape the catheter to the abdomen.
There are 3 steps you should follow to clean the site. First step, wash your hands with an antibacterial soap. Be sure to dry your hands with a clean towel. The second step is to prepare a mixture of half water and half hydrogen peroxide. Use this solution to clean the area around the gastrostomy, gently loosening any crust or drainage. And the third step is to dry gently. No dressing is needed. It will be normal to see drainage for 2 to 4 weeks. 2 weeks after the initial surgery, discontinue using the hydrogen peroxide. Wash the area during normal bathing times and pat it dry.
Children who have had an anti-reflux procedure or a Nissen fundoplication need to be vented. Before every feeding, and at least every 4 hours, you must provide an outlet for air or stomach contents through a decompression tube.
First, attach a 60 cc catheter tip syringe without the plunger to the decompression tube. Open the device and insert the decompression tube into the device. Make sure the decompression tube is unclamped. Any excess gas or liquid in the stomach should escape through the tubing. Return the stomach contents. Flush with water and then remove the tube.
I thought that when I got her home, you know, everything would be hard because I didn't have somebody standing over me, you know, directing me how to do it. I was on my own.
You do go through fears. You go through, am I doing this correctly? Am I doing this the right way? Is this supposed to look like this?
All the uneasiness and bashfulness and all that stuff, it goes away, you know, when you start thinking about and break it down to the true meaning is to sustain life.
Sometimes your child may need more time between feedings to digest food. If so, their abdomen may swell or they may vomit. If this happens, you will want to check the amount of fluid that is present in your child's stomach before feedings. This fluid can be a combination of both acid and formula. The fluid is called residual.
To check your child's stomach residual, first attach a 60 cc syringe without a plunger to a feeding tube. Next, insert the feeding tube into the skin-level device. Make sure the feeding tube is unclamped. Rolling your child on his or her side will help the residual fluid drain into the tubing. If the residual is more than 1/2 the amount of your child's previous feeding, then wait. Your child needs more time to empty their stomach. Wait 30 minutes and recheck the residual before giving the next feeding. Always return the residual fluid back into the stomach. Then flush with water.
If abdominal swelling or vomiting continues, contact your physician. Some children may need medicine to help speed up the amount of time it takes for them to empty their stomachs. Even though you're now feeding your child through the gastrostomy, it is very important that you don't forget their teeth and gums. Gums need to be massaged and teeth cleaned and flossed.
In a very young child, the gums can be massaged with a toothette or moistened with a washcloth placed around your finger. It's also a good idea to offer a pacifier to a baby during the tube feeding so they can connect the feeling of hunger with sucking and filling their full stomach. Sucking will comfort your baby and should be encouraged. You should moisten their lips with Vaseline or water.
Once they're able to eat, or if they are able to eat by mouth, then you can associate the feeding along with the oral feeding, so that way they know that this is this is mealtime.
And sometime even during the continuous feed, he'll want to breastfeed or bottle feed, and he's a pretty happy eater and pretty satisfied.
When you leave the hospital, a feeding schedule will be developed for you. You will learn the type of formula you need and how often and how much you should feed your child.
When you are ready to begin feeding, clean the top of the formula can with soap and water before using. Shake the can well before opening and always check the expiration date. Wash your hands with antibacterial soap and dry with a clean towel.
There are 5 basic steps you will need to follow for a bolus feeding.
Step 1 is to vent any air or fluid with a decompression tube. Step 2 is to attach a syringe or pump tubing to the feeding tube. Step 3, pour your designated amount of formula into the bag or syringe and let the formula run all the way through the tubing. Step 4 is to place the feeding tube into the device. And step 5 is to simply let the formula feed your child according to your feeding schedule and instructions. If you have an infant, hold your baby in your arms as you normally would to feed him or her. Your baby still needs that special cuddle time during feedings. Be sure to keep your baby's head raised while feeding.
If you are using a continuous pump to feed your child, you will need to follow 7 steps.
Again, step 1 is to vent any air or fluid with a decompression tube. Step 2, attach the feeding bag to the continuous tubing set and to the pump, according to your pump manufacturer's instructions. Step 3 is to close the clamp on the pump tubing. Step 4 is to fill the feeding bag with the amount of formula designated in your feeding plan. Step 5, close and hang the feeding bag. Remember to hang the bag at least 18 inches above the top of the pump. Step 6 is to open the control clamp while holding the drip chamber upside down. Allow the formula to rise above the tubing inside the drip chamber, and then turn the drip chamber right side up. Make sure the entire tube fills with formula. Finally, follow your pump manufacturer's instructions to set the pump at the appropriate feeding rate. Your doctor may instruct you to add water to the feeding bag. Placing your child on his or her right side will help the feeding empty from the stomach normally. Remember, for feeding periods that last longer than 4 or 6 hours, you must place ice in the outside pouch of the feeding bag. You must also change the feeding bag daily. Store any unused formula in the refrigerator with plastic wrap covering the top of the formula can.
When I go to feed him, he'll help me. He'll hold the tube. He knows how to, connect it, and he knows exactly what to do with it. Frank will lay down on the couch for me, and he'll lift up his shirt, and he'll try to help me connect it. And you'll find that this is a normal occurrence for them. They don't look at it as being strange. They don't look at it as being a hindrance or anything.
From time to time, you will need to give your child medicine. Every child catches their fair share of colds.
When your child needs to take medicine, whenever possible, use liquids. If tablets must be used, crush them to a fine powder and let them dissolve in 10 to 20 cc's of warm water or formula. Capsules can be opened and their contents dissolved in the same manner. If a medicine does not dissolve in the water or formula, you can mix it in applesauce or pudding and administer by the tube. Remember to always flush the tube with water between medications. To give your child their medicine, open the safety plug on the device and attach the bolus tube. Draw the medicine into a syringe and inject it into the tube. Flush with water, detach the tubing, and close the safety port.
You now have seen how to use your feeding tube. The rest of this video will focus on what you will need to do if your gastrostomy tube leaks, if it becomes clogged, or if it comes out. Also, what you should do if the tissue surrounding the site becomes irritated or infected.
You do get a feeling of inadequacy. You wonder if you're doing things right, if this is helping him, is there something else I need to be doing? And I think with parents, that happens with a lot of different things.
If your child's gastrostomy tube begins to leak, you must first determine where the leak is occurring. Is it around the tube or from a broken valve within the tube?
If your child is fitted with a skin-level device with a soft retention dome and the device is leaking, consult your physician immediately. If the device is defective, it must be replaced by a physician. This type of device should be replaced yearly or as your child outgrows their current device. Sometimes the water in a balloon may have evaporated or leaked and will need to be replaced. Check the balloon and add the difference if needed. Normally, 3 to 5 cc's of water is necessary to secure the balloon inside the stomach. Never use air to fill the balloon. It is acceptable to add 1 to 2 cc's of water to increase the balloon volume. Never exceed 5 cc's because the balloon may break.
Your attitude is everything. One thing that, it's a simple thing that I found that really helped me relax every time that I had to, I guess, change a Foley or change a Mickey or, take care of a challenging situation was, I would sing to Mark, just simple little nursery rhyme songs, and it helped relax me, number one, and it helped relax him, and it kind of just took both our minds off of really what was going on. So just, the PMA, positive mental attitude, is really, really important.
If a leak occurs, the area around the tube must be protected. You can use stomach-adhesive powder to dry the area. Then cover liberally with a zinc oxide cream. Take a gauze pad, size 2 inches by 2 inches, and fold it in half, placing the folded edges against the device. You can also cut the pad in half and place the pieces around the device. To secure the gauze pad, place tape gauze to gauze only. Do not tape to the skin. Change the gauze when it becomes wet. Keep the site clean and dry. Your physician may prescribe medication to decrease the acid in the stomach while the site heals.
Occasionally, the gastrostomy tube will become clogged by food or by medication. Remember to flush the tubing with approximately 10 cc's of warm water after administering food or medication.
Diet soda or cranberry juice will dissolve unusually stubborn clogs. Gently inject the warm water, diet soda, or cranberry juice, slowly allowing it to flow back out of the tube until the blockage is cleared. Do not use pressure to clear a blockage. Routine cleaning will prevent clogging. Use a water and vinegar solution or warm soapy water to wash the tubing.
We got his cord caught on, one of the arms of the seat in our van, and we were still passing him, but his cord was immobilized, and it pulled him out, which started him screaming. And when Debbie saw that, I mean, that was like the biggest thing that ever happened. You learn how to handle it, and even though the first time you might be very apprehensive, once you learn that the site's not going to close up immediately, it takes several hours. He doesn't have to have any feeding or anything, nutrition right then and there. And what she alluded to before, really it's just controlling your own emotions and your own fears so that you can pass that on to the child, so the child can be relaxed.
If your child's gastrostomy tube comes out, it needs to be replaced immediately to prevent the opening from closing.
If the tube is a skin-level device with a balloon, fill a syringe with 5 cc's of tap water. Connect the syringe to the balloon valve and push the water into the balloon. The balloon should inflate. If it does not, get a new device. Next, remove the water from the balloon and disconnect the syringe. If needed, cleanse the gastrostomy site and pat it dry. Insert the skin-level device into the opening and fill the balloon with 3 to 5 cc's of water. After inserting the device, notify your physician. They may want to obtain an X-ray to make sure the tube is still in the stomach.
If the feeding tube is a Malacot or Pesar catheter and it falls out, you must insert a Foley catheter.
To insert a Foley catheter into the opening, fill the syringe with 5 cc's of tap water. Connect the syringe to the side port of the clean Foley catheter. Push the tap water into the catheter. The balloon at the end of the catheter should inflate. If it does not, get a new one. Remove the water from the Foley and disconnect the syringe. If needed, cleanse the opening and pat dry. Wet the tip of the new clean Foley catheter with a water-soluble lubricant. You can buy water-soluble lubricants at a pharmacy or grocery store. Next, insert the tip of the catheter into the child's stoma about 1 inch past the deflated balloon. Fill the balloon with 3 to 5 cc's of water. It is important that the balloon does not pass beyond the area where the stomach empties into the small bowel. This can be prevented by ensuring that the balloon is tight against the stomach wall, as demonstrated in this diagram. Pull gently on the tube, feeling the balloon up against the wall of the stomach. Place the catheter plug in the end of the catheter to prevent stomach contents from spilling. It is necessary to tape the catheter to the abdomen to prevent the balloon from moving too far into the stomach. Tape the catheter in an upright position without tension on the tube. If your child becomes irritable or vomits after using a Foley catheter, contact your doctor. Also, if anything about the placement of the Foley catheter seemed difficult or unusual, call your doctor right away.
This is something that's got to be done. This is just like anything else. When you start something new, there's always a little difficulty in kind of, getting adjusted, just like a new job. You'll be scared at first. You'll find that these kids are tougher than you think they are. They have a lot of stamina. They can withstand a whole lot. And with the feedings and everything, there's really not a lot you can do that will actually hurt or cause damage. I mean, they give you good teaching before you leave the hospital. And they will send you home with phone numbers of people that you can call, people that will tell you over the phone, yes, this is correct, yes, you're doing the right thing, and tell you what to look for. So that kind of eases the fears a little bit.
Erosion occurs when there is tension on the device, resulting in tearing of the gastrostomy site.
Leaving the tube out for 2 to 3 hours with the child on his or her right side will also allow some healing. However, this should only be done with a doctor's supervision or guidance.
Each device should rotate freely and have 1/8 of an inch of room above the skin. Good fit is important and should be checked frequently. Any device can cause a pressure sore if the shaft length is too short. For this reason, fit should be measured with the child lying on their back and then sitting up. Treatment involves exchanging the device for the appropriate size.
Granulation tissue, also called proud flesh, is raised up, beefy red tissue which heals wounds. It is your child's body trying to heal over the new opening.
Granulation tissue is made of blood vessels and bleeds easily. If it continues to leak and bleed, the gastrostomy site may enlarge if not treated. To treat, apply Xylocaine 2% jelly to the raised tissue. Touch the raised beefy tissue with a silver nitrate cauterizing stick until the tissue turns gray. Protect the skin around the granulation tissue with Vaseline or barrier cream so that the surrounding tissue will not be affected. Reapply as needed every 1 to 2 days until healed. An alternative treatment is the application of Triamcinalone cream 0.1%, 3 times a day until healed. Your pediatric surgeon will write you a prescription for a silver nitrate cauterizing stick, Xylocaine jelly, and Triamcinalone cream.
As far as playing, the tube being in place doesn't hinder anything. I mean, it's under his shirt. You know, he can play and run around just like everybody else.
Doesn't get in the way a bit. I go rollerblading when I have a chance. I do whatever I please.
We live life. I mean, you know, he swims in a little swimming pool. I mean, he takes a bath like any other child. He plays ball, he runs around the house. I mean, you know, it's a normal lifestyle.
Fortunately, true site infections are rare. Usually there is some redness and drainage around the site that is mistaken for infection. However, when a true infection occurs, redness and swelling will measure 10 to 20 millimeters or 1/2 to 1 inch around the tube. This will need to be treated by your pediatric surgeon.
The biggest thing is not to panic. There's always somebody that is a telephone call away. And that's what's been so great about, you know, the team and the staff at UNC, that anytime that we've had a question or we've had a challenge, you know, we've been able to call somebody and they've been right there for us.
We hope you have found this video helpful. You may want to watch it more than once and keep it handy in case you need to refresh your memory on how to follow any of the procedures. It is important that you maintain good communication with your physician or nurse after you leave the hospital. Do not hesitate to call if you have any questions or concerns. We wish you the best in providing care for your child. By following the guidelines in this video, you will be providing your child with a wonderful advantage early in life by assisting them to grow healthy and strong.
What we found was it was a big change of life, and it was for the better. Different things that she hadn't been able to do, she now could do.
She was stuck at around 7 pounds for a pretty good while. She's over 13 now, so you know she's gaining her weight and she's really active. You can't get her to be still.
But I mean, that's been a godsend to have that in there, because I don't know if he'd be here if it wasn't for that placement.
Don't think that life has to stop because your child has a G-tube. It's like I said, it's an alternative way of feeding. Instead of by mouth, you're just using a machine to do it. It's still the nutrition and the love and the care that goes behind it. It's just an alternative way of doing it.
With this surgery, he is now 3 years old. He's 34 pounds of solid child. treat your child just as you normally would, meaning their feedings, this is a normal way of life for you and for the child. So don't be scared. You will make mistakes, but it's okay. You know, over time, you'll learn.
You're this child's primary care physician, even though, of course, you've got a pediatrician that technically is that person, but you're the person. You're the one that's there to love and care for that child. So, you know, the biggest thing is ask questions. You know, educate yourself.